Now, September is the start of National Recovery Month, and it's a time to recognize people who are working to recover from substance use disorders.
Just last week, the Mills administration announced new funding to help healthcare facilities. News Center Maine's Caroline LaCour met with some people who know exactly how much of a difference that money can make.
A time to reinforce support, celebrate those in recovery, and enhance strides in treatment. Just in time for National Recovery Month, the Office of Governor Janet Mills announced last week a new $1 million plan to increase recovery treatment in rural Maine. The money will be used by behavioral health providers for things like startup costs or staff training and development.
To make it more possible for a nonprofit behavioral health organization to add beds and expand, we need to do even more. And so that's what this initiative is about.
Those who will receive funding are substance abuse treatment facilities like Wellspring and Bangor. Executive Director Suzanne Farley says she receives patients from across Penobscot County. And although Wellspring was not part of this particular grant, she says the funding is tremendously important.
The goal to get more money into rural parts of Maine so that when we send our people back home after they've completed 6 months of treatment, residential treatment, that they've got a supportive community when they get back.
According to the State Epidemiological Outcomes Work Group dashboard, Penobscot County suffered more suspected overdoses than any other county in Maine since 2017. Holly Warmel has been in recovery since 2016 and hopes this initiative will be another boost to fighting addiction.
And it's a legitimate disease and it needs to be treated like such. And I think it's terrific that they're getting the funding to be able to start actually really treating it.
Steps towards prevention and treatment throughout the state. In Bangor, Caroline LaCour, News Center, Maine.